Welcome back to Midnight Med. This video is on diabetes pharmacology. In this video, we will talk about the different options available to treat diabetes, common adverse effects. So before we get into it, let's first talk about the pathophysiology of diabetes. So diabetes is hyperglycemia, so it's important to understand how glucose or how sugars are regulated by the body. So if the blood sugar level is high, how does the body reduce the sugar level? Well, so you eat glucose, you eat some food containing glucose, then the glucose in your blood increases. Now, in response to this, insulin is released by the pancreas. It then acts on liver and cells to take up the sugar. So the sugar is then taken from the blood into the cells, and that reduces the glucose levels in the blood. Conversely, how does the body increase sugar levels if the blood sugar levels are low? Well, on the other hand, glucagon is also released by the pancreas, and this causes glycogen to be broken down in the liver, and this forms glucose that can be released into the blood. So the main hormones to keep in mind are insulin and glucagon. Insulin reduces blood sugar levels, glucagon increases. So in terms of different pharmacological options, we have biguanides or metformin. Now let's think back to the glucose regulation. So metformin inhibits hepatic glucose release, and it also increases peripheral insulin sensitivity. So what that means is that because it's inhibiting hepatic glucose release, we're thinking about the glucagon stage. It's not releasing the sugar into the blood, so the blood sugar levels don't rise. And in terms of the insulin phase, it increases the sensitivity on the cells, so the cells are then more likely to respond to the insulin and then take up the sugar from the blood. So it works on both pathways. The most serious adverse effect to keep in mind is lactic acidosis, and then common stuff such as nausea and vomiting, hepatitis because it's affecting the liver function. You can also get rashes and a low B12 level, which can manifest as peripheral neuropathies. Contraindications include renal impairment due to the lactic acidosis and hepatic impairment because it causes hepatitis. The next thing is GLP-1 agonists or glucagon-like peptide-1 agonists such as liraglutide. So because, as the name suggests, it's like glucagon, so it's doing the same thing as glucagon would do to reduce the blood sugar levels. And because glucagon is released by the pancreas, it also reduces hypoglycemic events because it acts in response to sugar being eaten. This is a good advantage because some of the other diabetes medications like metformin could cause hypoglycemia if the patient goes for prolonged times without eating. Adverse effects include pancreatitis, cholecystitis, and GORD. These drugs are also used for weight loss. The next one are DDP4 inhibitors, such as linagliptine. DDP4 breaks down glucagon-like peptide 1. So if you're inhibiting that, you're really increasing the activity of glucagon-like peptide 1. And in that way, it has a similar mechanism of action to the GLP-1 agonist, in that it's acting on that glucagon pathway. Adverse effects include musculoskeletal pain, flu-like symptoms, so cough, cold, runny nose, as well as pancreatitis. SGLT2 inhibitors are the final one, for example, dapagliflozin. And an easy way to remember this is that it's flozin, so it increases the flow of urine, and you've got to reduce the blood sugar level to increase in glucose in the urine. Now, these adverse effects include UTIs. As you're urinating out more glucose, so there's more glucose in the bladder, this can form a medium for infection. You can also get candidiasis, so fungal infection, as well as ketoacidosis. So it's important if the patient's going for surgery, you stop these 2 days before. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.